I'll be talking about possibility awareness and the hidden possibilities that are in our lives, and yet we are not even aware that they're there. There are so many conditions that are hidden, and unless we know what we are looking for, we will not really be able to recognize these conditions and make a difference in our lives and in the lives of the people that we come across every day. The Bible says that my people perish for lack of knowledge. And truly, unless we are educated, we will continue to be in the dark. But we thank God that he uses different people, different kinds, different methods to get this message to us. He is still God even today. He is still healing, and he will deliver us. Leviticus 19 verse 14 says, do not curse the deaf or put a stumbling block in front of the blind, but fear your God. I am the Lord. So I'm going to talk about one of the conditions that is quite hidden called dyslexia. Dyslexia is a learning disability which affects skills involved in reading, writing, or spelling. And we don't know what is the cause. It tends to run in the families. Some families have got more children with dyslexia, and it does not relate to the person's general level of intelligence. It's quite common. 1 in 10 people in the UK actually have some degree of dyslexia. And it's a lifelong problem and can be a challenge, especially to children who are in school. Yeah. So what are the signs and symptoms that we look for when we think that a child or a person has got this dyslexia? Most of the time when they are young, nobody will notice them, but when they start school and they start reading and writing, these are the things that the teachers may notice, or even the parents. They may be a little bit slow or have difficulty in reading and writing. They may confuse the order of letters instead of putting the words in the right manner, or they may put it in the wrong way, or writing B instead of B. Quite a lot of spelling mistakes, consistently missing out words, misreading words, and difficulty in pronouncing words. And sometimes they find it difficult to understand information in a written form. But when you tell them verbally, they understand. But if it's written, it becomes difficult. So obviously, I mean, if you have a child, let's say under 5, they're just learning, it's not a problem. But if these signs are consistent and persistent, and you know that your child is old enough for them to be able to write things properly, and things are not going well, you can see that there's a problem. The teachers have pointed out there's a problem. I recommend that you get this checked. So advice that I'll give to parents and children who think that that their children might be having dyslexia. It's not a scary thing. When I first heard the word dyslexia, I thought it's a big word and scary, but it's not. What that means is that your child needs help, and you can help them to get it. It doesn't make them less able or anything like that. You just need some support. Some children have been diagnosed later on in life in their A-levels, and they've gone on to do, in their late time in school, but they've gone and performed really well in their GCSEs, progressed, and they have, gone to university and all that. That what helps is that if this is diagnosed early, then at least the teachers and the parents will be able to help this child, because they will be given more time during the exams rather than going with the rest of the students. They will have a little bit more time, and that will help them because they need to process things a little bit slower and a little bit in a different way. So if you think that your child has got dyslexia, not to worry, speak to their teachers, say these are the issues, these are the problems. Go online, find out what are the signs and symptoms of dyslexia. I've written on the slides here so that if you want to get this, you can get and say that, I think my child has got ABCD, and I think I would like them to be assessed for dyslexia. We have special education needs coordinator. They are called SENCOs. They will help you and they will signpost you in the right direction so that your child can be assessed for that. There are even private psychologists who help with this. I've put the website there. You can just go on the website and check and see if it's something that you think you have, they will be able to help. And for children, do not be scared. It's not a difficult thing. Keep on trying, and if you think that you have dyslexia, get it checked. Because sometimes I've had children whereby the parents have not recognized dyslexia, but the child has recognized that they might be having dyslexia, and then they will tell their parents. So if a child tells you, Mom, Dad, I'm having problems at school, do not dismiss them. Sit down, listen, and find out more and seek professional help. See your GP, see the teachers, something can be done about it. I've referred some patients who have gone ahead, got a diagnosis of dyslexia. They got all the necessary tools that are needed and they did really well. Okay, another condition that I'm going to talk about. Yeah, the British Dyslexia Association, you can see there's a website there and a telephone number. You can call them in case you have any doubts. Okay, the other condition I'm going to talk about is autism. Autism spectrum disorder, or ASD as it is called. It's a lifelong developmental disability which affects people, people's ability to communicate and to interact with the world. And about 1 in 100 people are on the autism spectrum, and there are around 700,000 autistic adults and children in the UK. We do not really know exactly what causes this, but it is thought that it is due to a neurodevelopmental problems in the brain. So we have, with autism, we have symptoms. Some are on the high end, some are on the medium, and some are on the low end. And we have more boys compared to girls, with a ratio of 3 to 1, 3 boys to 1 girl. But some have said that girls present differently and that they are very good at masking their symptoms compared to boys. And most of the time, the parents will discover this at the age of 2, where other children are progressing, they're verbalizing, but their children, you find that they have got a delay in milestones, loss of eye contact, very withdrawn, losing skills very fast. One parent said it was as if someone came and wiped out their child's memory. They have speech and language delay and poor social interaction and communication. Some are not able to talk, not able to play with their friends at nursery. And sometimes people may think that this child is lazy or doesn't care. And some are quite rigid and very repetitive. And some are quite dependent and have to be fed. Some of them cannot sit still. They're running around, easily distracted. And some are very aggressive. And sometimes this can be a safeguarding issue because they are danger to themselves and they are danger to the people around them. And some have attention deficit hyperactivity disorder, ADHD. It is a wide spectrum and everybody is different. People present differently. Okay, sometimes it's not picked up when they're young, but it's picked up when they're a little bit older. And what happens is you may have a child who may not understand what others are thinking or feeling. They find it very difficult to say how they feel. Let's say if something has upset them, they cannot express themselves. Some of them like very strict daily routines and they get very upset if things change. Some of them have got very keen interest in certain subject of activities, and some get very upset if you ask them to do something. And some of them find it hard to make friends or even prefer to be on their own. But let's say these are older children, but in adults, I didn't know that even autism can be diagnosed in adulthood, because it is an evolving area. People are learning every day. 20, 30 years in this country, people really did not understand about this condition. But as we are growing, I am having patients who are coming to me and they're saying, you know what, doctor, I think I might have some degree of autism because of ABCD. Thank God for the internet. People are Googling and saying that, no, there's something not right with me. Why am I having problems with people all the time? Why am I not able to do things? Why, you know? So nowadays, actually, we have a service whereby we can refer these patients. So speak to your GP. There are referral criteria, and I have referred patients who later on went and got a diagnosis, and that really helped them to interact, and even in the place of work and all that, because they had a diagnosis, and so the employers will understand, the spouse will understand, the people around them, siblings will understand. You find that they get very anxious, can't socialize very well, and some of them, when people come to me with anxiety, anger issues, and lots of things, failure to interact with people, and I refer them for counseling. And the counselors have written back to me and say, I will recommend that you refer this patient to for an assessment for autism or ADHD, because they have ABCD. And I've been able to help some patients who have also gone ahead and got a diagnosis. One thing, there's so much stigma in the people of Black and ethnic minorities when it comes to this. So the most important thing is getting a diagnosis is not labeling. We are not labeling the person. It is signposting them so that your child can get channeled to the right services. These are interventional services like the speech and language therapy, occupational therapy. Is normally a multidisciplinary team, we say, approach, whereby parents, schools, health visitors, GP, pediatricians, community pediatricians, all those services, social workers are all involved to help in making a diagnosis. It's not something that you go to the GP today and they will say that, yeah, you have a diagnosis. It is a process which we need to look into different areas. How is this child performing at school, at home? How are the issues? So we combine everything with all these organizations, and then we come up with a diagnosis. Again, in the Black and ethnic minorities, there are issues of denial on isolation, refusal to acknowledge that the child is autistic. And others believe that their child's difficulties should remain private and not being discussed outside the family home. Some of them, they blame the parents, or they blame themselves, and issues is shaming and fear of social isolation and rejection. So this can lead parents, carers, and siblings missing out on the support and becoming socially isolated. People are afraid of being judged. They don't want a diagnosis. Superstitions on witchcraft, and some people thinking that they are demon possessed or they have sinned. That's why they are autistic or they had autistic children. We should open up and accept that this is a condition. Child and parents are not to blame. No one is to blame for this. Because the Bible says in John 9, verse 2-3, and his disciples asked him, saying, Rabbi, who sinned, this man or his parents, that he was born blind? Jesus answered and said, neither this man nor his parents sinned, but that the works of God should be revealed in him. So we should avoid blaming. And the other thing is, once you have a diagnosis, the benefits, you can get benefits from the country, which without a diagnosis, you will not be able to get. The benefits will help you to manage your child, and there'll be placed in a special school where they have professional teachers to teach them. These children can go on to live a normal life with good support. The Bible condemns division, so these people should not be looked down upon. If we have such a child or a person in the church, their needs should be taken into account. We should try and accommodate them and include them in various activities. Work with the parents, work with the individuals. Parents have complained that they feel judged, their children are not accepted. And one mother said that when they moved to a new church, she was told to leave as the church could not manage their child. Can you imagine how sad that is? Let us not be like this. Let us encourage our children and those who have got children who have got difficulties. Another condition I'm going to talk about is dysplasia. I remember growing up in Africa, and you'd see people who are lame, limping a little bit. Now, having studied these medical conditions, I've come to realize I think some of them had developmental dysplasia of the hip, or we called it DDH, or congenital hip dislocation. But it was not picked up when they were young, and so they went on to have this limp for the rest of their life. It's a condition whereby the ball, this is the ball, let's say this is the thigh, the femur bone. So this is the ball, and this is the socket on your pelvis, whereby the hip is the leg is attached. It's supposed to be like this, but in this condition, you find that it's a little bit loose. So what happens is, if every time the child moves, it comes out of its own space there. So it's not tightly linked nicely with the pelvis. So it may affect one or both hips, and it is more common in girls, they say, and firstborn children. We don't know why. About 1 or 2 in every 1,000 babies have this condition, and that needs to be treated, because without treatment, this may lead to problems later on in life. Developing a limp, as I've said, hip pain, especially in teenage years, painful and stiff joints, osteoarthritis, and then, so I advise that early diagnosis and treatment. With early diagnosis and treatment, most children will be able to develop normally and have a full range of movement in their hips. Okay, I normally do 6-week baby check, and one of the things that I look for unstable hips, and if there's any clicking, and if there's anything like that, I will refer them for an ultrasound scan so that they can get a diagnosis. Or if a child was breached, most of the time, a breach presentation, the hospital will pick that up and they will do a scan. If there's a family history of hip problems from a very early age, we also refer them for scan, or if you have twins, or if for some reason I'm just not happy with the hip, I will refer the child. There's a special charity for this, and it's called stepscharity.org. You can see it on this on the slides. You can get help from them and learn more about this condition. Treating, we use a special fabric splint, which is called Pavlik harness. And what basically does is secures the baby's hip in a stable position and help them to develop normally. If this one fails, then the next thing is surgery. Okay, and then I'll be talking about anxiety. I'm sure most of us are familiar with anxiety. Isaiah 41:10 says, "Fear not, for I am with you. Be not dismayed, for I am your God. I will strengthen you. Yes, I will help you. I will withhold you with my righteous right hand." What a promise. God is always right there beside you, beside me, to help you, to help me. So what is anxiety? It's a feeling of unease. Like this morning before coming for this presentation, I had a bit of anxiety. What if the Zoom doesn't work? What if the PowerPoint, a little bit of worries. That is normal. Most of us, if we have to go for a job interview or, something, we get a little bit anxious. But it's normally for a short time and it passes. It does not occupy the rest of your life for weeks and months. So worrying, fear, some people have mild, some people have severe symptoms. And for example, now we are in a pandemic. I was very anxious when the pandemic started as a medical doctor, thinking I have to go and see patients. What if I catch COVID? What if I had all those worries when the pandemic started? But to God be the glory. I did catch COVID, but God healed me and my family, my husband, my children, we all caught COVID, but God healed us. To God be the glory. He is still Jehovah Rapha in the business of healing even today. But with the pandemic, I've had a lot of people coming with anxiety, and I'm seeing people who never had anxiety before coming with anxiety because obviously the whole world is under turmoil now with this coronavirus COVID-19 pandemic. Some have lost their jobs. Some, the source of income is gone. Some of them have lost their loved ones. So much has been happening. So these are the things that can cause anxiety, challenging times. So in generalized anxiety disorder, as we call it in the medical term, GAD, can affect you not only emotionally and mentally, but also physically as well. So I'm going to touch on some of the signs and symptoms, things to look for. Some may have 1 or 2 symptoms, but some may have more. And you should see your GP if you think that you have anxiety and issues related to it. So the psychological symptoms of anxiety, feeling nervous, as I've said, inability to stop worrying, or you're worried about the issue that other people are not worried about. Say, why are you worried about? But you're just worried. You're trouble controlling your worry. You are restless. You cannot relax. Easy irritation, fear of something awful happening, panic attacks, all those. So, and sometimes due to these symptoms, you may withdraw from your home. Like you may see that someone does not want to come to church anymore. They are not logging on to Zoom anymore. Having difficulties at work, stressful. Sometimes stress at work can cause that. And you start seeing people are taking some time off. They will come to me and say, I'm very anxious. I can't go to work. I need some time off work. So this action can make you worry even more about worry more about yourself and increase your lack of self-esteem. Physical symptoms. I've had people, especially people from all backgrounds, from ethnic, Black and ethnic minorities, they find that they do not recognize the symptoms of anxiety. So some people will come to me complaining of feeling tired all the time. My heart is beating fast. I'm dizzy. I'm tensed up all the time, trembling, dry mouth, sweating, short of breath. My stomach is emptying. I'm feeling as if there are butterflies in my stomach. I'm feeling sick, a headache. I'm having pins and needles. I can't sleep. So these are the things that, and also obviously, if you've had a bereavement or major life changes, let's say divorce, sickness, loss of a job, stress at home, or any post-traumatic experiences, this can cause anxiety. And some people have got phobia of certain things, so panic disorders, like claustrophobia, fear of being in a confined space. I've got some patients who say, I can't go for a CT scan of an MRI because I'm scared of being confined on that, they call it a donut, and things like that, or in a tight room or where there are many people, they get, worried and anxious. So, or sometimes it may not be clear what exactly is causing your anxiety. So if you have any of these symptoms, because I've seen patients, as I said, coming in, what I would normally do, sometimes, and you try to find out what is causing this person to be anxious, and you cannot really find. Nothing has happened in their life, but they're just anxious. Go to your GP. And what I would do, I would do some blood tests to rule out other conditions, because anemia, which is iron deficiency anemia, or vitamin B12 and folate deficiency, can cause anxiety. And especially women during their monthly cycle, sometimes they lose quite a lot of blood. They don't know. Some of them, because since they were teenagers, it's been like that. They've learned to put up with it. But then because of the anemia, they're getting palpitations, anxiety, they're getting short of breath and all that. So it's important to get some blood tests. And also a condition called hyperthyroidism, which is basically an overactive thyroid gland, can cause also symptoms of anxiety and other conditions. So you can ask for a blood test, go to your GP and say that I would like to have a blood test just to make sure that everything in the physical is normal. And treatments, these patients, I do have some of them, they will come, I will talk to them. The fact that they just came, talk to me, that is therapy enough. I will follow them maybe for 2-3 times in a space of 2-3 months, and then after that they are fine. Gone, we don't need to do anything. Or maybe there was an issue that was causing the anxiety, but then with time, with the GP support, they are okay, they don't need anything. There are some who come to me, so I will do an assessment, and I'm thinking these ones, I will need to refer to a professional counselor. And some of them, I said these ones, I will need to start them on medication because the anxiety is so bad and it's affecting their lives. So it depends on how the patient is. I will do an assessment and then decide which route to go. And some of them need both medication and counseling. So we will do that. There's something called cognitive behavior therapy. You go and see specialists who will look into what is causing the anxiety and give you the tools to help you to deal and to overcome that anxiety. Some people, especially people of faith, they are worried about taking medication or it's addictive. Anti-anxiety and antidepressants are not addictive. What you will get is discontinuation symptoms. That's why if you've been on it, you cannot just stop the tablet today. We will withdraw it slowly, but it's not like the benzodiazepine, the diazepam and all that. Those are addictive. But these are the ones, if you need in order to function properly, then you can take it. And it's not necessarily that it's lifelong. You will be reviewed at intervals to see how you're getting on. So we'll have, I can see because of time, we have things like medication, maybe some of you have heard. If not you, probably the people around you or relatives or friends, they are called selective serotonin reuptake inhibitors and others. We have sertraline, citalopram, fluoxetine, paroxetine, and they can't take time to work. I've got people I've prescribed today, they're coming after 1 week, the medication is not working. No, for some people it may take up to 2 months for the medication to work. And then we have depression, which can present as low mood, loss of interest or pleasure in doing the things that you usually used to enjoy. You find that this lady used to come to church, they're very happy, bubbly, all of a sudden they've stopped coming, or they are coming, they are quiet, they are not talking. So these are the things to look out for in the church community. Loss of appetite or overeating. Some people are not able to concentrate. Some feeling bad about themselves or they're a failure, they failed themselves, they failed the family. And some have got suicidal thoughts, they want to end their lives. And some are cutting themselves, deliberate self-harm, or they are taking an overdose of drugs prescribed, or even some people go and buy and accumulate paracetamol, or go to various chemists and get some medication just to overdose. So basically, I mean, if you have some of these symptoms that I've described and you're worried about it, then seek medical help. A day or two of feeling a little bit low because of something that has happened, or a bit anxious is not a problem, a week or two, but then if it goes on beyond 2 weeks and it's really affecting your ability to do things, then it is time to seek help. About 5 in 100 people have depression each year, and 1 in 5 people will suffer depression at their lifetime. So it may not be now, but later on you will recognize and remember, this is what I heard, I need to seek help. And I find that depression and anxiety tend to go together. So mental health disorders are among the leading causes of ill health and disability in the world nowadays. So let us seek help, just like how you would go to your GP and seek help when you have a cough or a tummy ache. Then I recommend that you also go to your doctors and get help so that you can be helped with any of these conditions, so that the issues about mental health can be addressed. It is so sad. I have seen people who, if they came early they could have been helped early before things got bad. But they kept it secret. They just stayed for years and years. And by the time they came to us, they were really bad. It doesn't mean that you cannot be helped and you cannot be healed. You can, but it becomes more difficult if the issue has been there for a long time. But God is Jehovah Rapha, is still the healer even today. He says he will restore health to us and heal us of our wounds. So even the mental wounds that the enemy has caused on us, God can still heal us. And he still uses people like me, the counselors, to help in the process of healing and support. And people of faith, the pastors, the elders can all be used also to be a channel of healing for these people. So my brothers and sisters, I'm requesting, let us not be judgmental. Let us therefore be there for one another and help those with special needs. The Bible says in 3 John 2, beloved, I pray that you may prosper in all things and be in good health, just as your soul prospers. So good health involves good mental health, emotional, psychological, physical, and spiritual, holistic, to be whole. And if mental health suffers, eventually the physical body suffers. People develop conditions like high blood pressure and diabetes, all sorts of things because of the mental health that is not okay. And vice versa, if you have a physical condition, the body is suffering, then our mental health suffers because you are in pain. Let's say you're in chronic pain or whatever condition it is. This leads to anxiety and depression. So my advice is that seek help early if you think you have any of these things, or if the people around you have these things, or you spot something like this in one of your, anybody, seek help early. I put some important websites there and contacts. Samaritans, these are people who are there 24/7, and it's a free number. If you are down, if you're feeling suicidal, and not only suicidal, because before I thought only people who are feeling suicidal were self-harming, but anyone, if you're feeling down and you need help, call the Samaritans and they'll be there to help you and signpost you to the right services. There's also IAP, which is improving access to psychological therapies. NHS, if you just Google that, and it will come and you put your area, they are there. There's also Mind, another organization which helps with people with depression and anxiety. And if you're being bereaved, especially in this pandemic, most of us have been bereaved. We have Cruise Bereavement Center, and that's the website there, cruise.org.uk, and their phone number. And there's CUTH. This CUTH is an organization which deals with counseling as well. And it's very good for young people online. It's anonymous, so you can contact them. And obviously we have our own South England Conference Cornerstone Counseling Service. This can be used as well. So I pray that as we continue, may God help us. May we not perish for lack of knowledge. The Bible says, do not be anxious for nothing, but by prayer and supplication, present your request to God with thanksgiving, and the peace of God that passes all understanding will guard their hearts and minds through Jesus. Jesus is the center of our joy. Jesus is Jehovah Rapha. He is our healer. When he went around this earth, what did he do? He went around healing people with all kinds and all sickness. He did. He healed. He delivered. He is still God today. He is still delivering, and he can do that. So allow him to signpost you. He may heal you divinely. You don't need anybody's help through prayers, but there may be a time that he will signpost you to the right people, people who are still used for healing, people like us and other people, the counselors, everybody involved in one or another. God still uses his people to heal even today. So may God bless us all as we continue. I hope that this has helped you and me as well to be able to recognize those hidden disabilities and seek help as we continue to grow in the Lord. God bless you. Thank you.